Signing his commitment of kindly allow me to invite the
We humbly request Your Excellency. The second one to the Chair Health Committee, Council of Governors, Honorable Governor Mohamed. The third one to the Chairman, Kenya Health Federation, Dr. Hamid Takar.
If indeed we are going to become the health tourism sector in this region, why do people go elsewhere? First is the cost of healthcare. Your Excellency, the reason for the cost of healthcare is multifaceted. First is what my colleague said, the cost of equipment. And here going forward, we would beseech banks to be sensitive to the fact that the equipment should be amortized over a much longer period than the 3 years that they would give an equipment purchaser. Secondly, Your Excellency, I have a small formula. And the small formula is cost of healthcare, may it be diagnosis, may it be equipment, may it be visit to the doctor, should be less than or equal to India. Less than or equal to India. Why would I come to Kenya if the cost is higher than India? So the formula that I see working for us is equal to or less than India. And then work backwards from there to say, how then do we make it at less than or equal to India? Secondly, Mr. President, is to heighten the doctor professionalism by restructuring the non-clinical soft skills training, promotion of patient-centered approach to patient care, and multidisciplinary group practice as opposed to individualistic treatment approach by specialists. Your Excellency, we are changing time. Technology will come to bear. It is possible for a doctor in Kenya to consult with a doctor in Johns Hopkins University by use of current technologies. And therefore, we are asking our doctors and our professionals in healthcare to also recognize this fact and work with them. Your Excellency, let me also say that naysayers will try and make it look like Kenya is so wanting and so bad in our healthcare structure. We are not. We are not that bad. We can do better. We will do better. We are going to do better. But we are not that bad. Let it not look like we are collapsing. Because when you see people from the region still coming for healthcare here, then we are not as discouraged as one would want us to be. But we must stop certain practices. Because professionally, Your Excellency, there are those creating challenges. Let me give a very good example. Beyond Zero, where the First Lady is really active and helping us, I am told that there are some places where a pregnant mother will go, deliver normally, and then the clinic will say, why are you going home so early? Because we can earn a little bit more money if you stick around a little bit. That is a fact. It is happening. So some of these practices is what we must also professionally deviate away from. It is not everybody, it's just one or two people. The majority of our doctors are extremely hardworking, extremely harassed by too many patients to a doctor, but we also appreciate that in every market, there will be a mad person. Thirdly, Your Excellency, is the question of ICT, and I can't re-emphasize more on the issue of ICT. I am going to establish an ICT directorate at the Ministry of Health to leverage on ICT and fully automate the health sector, starting from Afya House, promote e-health, and create linkages locally and internationally between centers of medical excellence through telemedicine.
We are establishing now a very good cooperation to make sure that your dream to have Kenya have universal health care is realized within this term of yours. And that can only happen when we focus on the patient and mwananchi rather than all of us clinging on to this is county government, this is national government, but this is one government serving its people together, be it at the national or the county level. On behalf of Council of Governors, we commit to the implementation of high-quality health systems as documented in the Kenya Quality of Care Manual and the Kenya Quality of Care Framework together with the Ministry of Health. Thank you.
On behalf of the private sector, at this convention, commit to implementation of high-quality health systems as documented in the Kenya Quality of Care Manual and the Kenya Quality of Care Framework, together with the Ministry of Health and other stakeholders. We look forward to strengthening the system. Thank you.
On behalf of the Ministry of Health, I commit to ensure that quality processes are regulated and coordinated through policies that are continuously updated and reviewed. I also commit to build and enhance capacity of the implementers, that is, counties, faith-based and private sector, including all actors offering health services in order to deliver the highest quality of health services to all Kenyans. Thank you.
I believe that Kenya is strategically positioned to serve as a medical tourism hub for our sub-region. Indeed, our own private hospitals have been attending to patients from Uganda, Rwanda, Burundi, DR Congo, Tanzania, Ethiopia, South Sudan, Nigeria, and Kenya remains a pioneer, both by way of policy and by the advancement in medical technologies. And now, more than ever, I believe we must converge as stakeholders to see how we can improve the quality of our healthcare. As demonstrated by what we have seen so far in the expo that is out there, innovative models of partnership between the public and private sectors can significantly improve Kenya's health outcomes while providing insights for others in the developing world. A sustained focus on healthcare excellence in Kenya is therefore crucial, not only for our nation, but for the world at large. Kenya's position as a regional resource for high-quality care is a huge advantage, and I believe we can leverage this even further. As our battle against infectious diseases and threats like coronavirus have shown, collective efforts can make miracles happen, underlying the importance of multifaceted intersectoral collaboration between various partners to achieve the shared goal of health for all. Furthermore, investments in the health sector must also be complemented with cross-sectoral investments in education, nutrition, hygiene, social protection, which yield compounding benefits on healthy societies. I recognize that we still have a very long way to go. Today, more than 10,000 Kenyans travel abroad annually in pursuit of medical treatment, spending at least 10 billion Kenya shillings. Cancer patients make up more than 50% of Kenyans going for medical treatment overseas. Indeed, across the continent, Africa spends approximately 380 billion shillings, or $3.8 billion annually, in search of healthcare overseas, predominantly India, Thailand, and the Middle East. Kenya's healthcare industry has a long history of a deep and meaningful partnership between state and non-state actors. These relationships have extended the reach of essential quality health services to Kenyans, especially in hard-to-reach areas. And more recently, the government has partnered with the private sector to equip public hospitals across all 47 counties, availing access to specialized medical treatment that was previously inaccessible to many. Indeed, as has also been noted by previous speakers, healthy citizens are an integral part of building healthy and robust economies. The economic gains that Kenya has made over the past few years can only be sustained if our population is healthy and the healthcare costs are affordable. And it is for this reason that my administration has prioritized the attainment of universal health coverage as a strategic intervention for our envisioned socio-economic transformation. We did launch the pilot in December of 2018 in 4 of our 47 counties. And from what we have seen over that period in those 4 counties, we have seen increased access of essential medicines and medical services to excess of 3.2 million Kenyans. The national rollout of the program to the remaining 43 counties and by extension to every Kenyan is on course to improve access to quality health care within their respective jurisdictions. And I think the sustained commitment of resources towards health, averaging 30% of county budgets, has seen an increased recruitment of healthcare workers and availability of essential medicines and other medical commodities. I therefore call on all the non-state actors, our private sector, including medical service providers, insurance companies, and financing institutions, to join hands with us in pooling of resources that will extend the reach of quality medical services across our country. We have reason to believe that the world is now, much more than ever before, looking up to Kenya. We, as a country, must now aim to become a serious healthcare provider. The march to quality health cannot be delayed. It is the key to sustaining a success story in the long run. To transform the ideas emerging out of the Healthcare Convention into reality, I believe all stakeholders here need to make collective efforts towards achieving good health for all. And I urge all participants present to make it your mission as individuals and collectively to infuse in all a passion for health.